And what we've done as a society is we no longer feel the symptoms of stress. We just constantly work through or push through or strive through.
But this sort of baseline level of constant chronic stress or constant chronic elevated cortisol is really bad for us.
And the recovery is the key part of the stress cycle. Without the recovery, the cycle isn't completing, and that's when stress can compound.
So now it's my kind of goal and role to teach people how to manage stress better.
And I think what's really smart is you don't have to wait until it's really, really bad. The sooner you act and build this toolkit, the better. Hello, I'm Dr. Zoe Williams and welcome to our latest episode of Inside Health. And today we're going to be discussing stress. Now, a recent UK report found that 9 in 10 adults experienced high or extreme levels of stress at some point in the past year. And it's not hard to see why. Modern life rarely switches off. We're navigating constant digital connection, financial pressures, blurred boundaries between work and home, and a world that often feels unpredictable. For many people, that means living in a near constant state of pressure, always reacting, always juggling, and rarely getting the chance to fully switch off. Some stress is helpful. It can push us to respond, adapt, and get things done. But when stress is ongoing, unaddressed, or allowed to build over time, it doesn't stay still. It can start to snowball, turning a real toll on our bodies, our mood, and the way we live our everyday lives. And over time, increasing vulnerability to mental and physical health difficulties. Today, we're going to explore what stress really is, how it shows up differently for different people, how that spiral can begin without us realising, and most importantly, what we can do to break that cycle before stress takes over and transitions into illness. And as we go through today's conversation, we really want it to be a two-way discussion. So if anything we talk about resonates with you or brings up a question, please do send your questions in. We'll be answering them later in the session. So today I'll be talking to Dr. Claire Atkinson, who's a counselling psychologist at Bupa, and she's going to help us understand what's happening in our minds and bodies when we experience stress and what we can do to dial it back. And we'll also be joined by Michael Adu, who's stress reduction specialist and director of London Stress Centre, and he's going to be sharing his own first-hand experience of stress, as well as provide some useful tips on how to address stress in our own lives. So Claire, for a lot of people watching, I think that our lives are so stressful, we almost accept stress as part of everyday life. So how can we tell the difference between normal stress and stress that's starting to potentially be bad for us?
I think that's a really good question. Stress is inherently part of our everyday lives. And for stress to be normal, it really needs to be short-term and related to situations, so situation specific. When it's long-term for prolonged periods of time with no ease or let-up, then it becomes problematic. Warning signs that stress is tipping into more challenging areas is when there's an impact on your appetite, on your sleeping, on your mood. You might notice you'll become more irritable and just feeling less able to cope with day-to-day activities. I think it's really important that we recognise that stress isn't just emotional. A lot of people think that it's very physical as well and can manifest with physical symptoms. So you might notice headaches or gut issues, lowered immunity, frequently getting unwell. These are things that stress is becoming a little bit more unmanageable and more difficult to cope with.
And what about stress hiding behind busyness? Why don't we always notice when it's becoming a problem? Is it partly because life is so busy?
Yeah, life is busy for everyone these days, and we often, put ourselves under pressure to work, faster, harder, stronger, and busyness can be socially rewarded. So it can look like productivity, it can look like commitment. But when we're busy, we're really focusing on the task. We are not noticing what's going on in our bodies. We're not noticing the physical symptoms of stress. So they're passing us by. So when we're busy, we're not paying attention, and that means stress can build up incrementally, or it can just feel normal to us.
So just a reminder for everyone watching, if you're recognising any of this in yourself and you have questions, please do send them in, because we'll be coming back to your questions a little bit later on. What's actually happening in our bodies when we experience stress? Do our bodies go through some kind of stress cycle?
Yes, definitely. So a stressor will happen and our body will go into fight or flight. And that's not bad. That is there to help protect us against danger. So when we're in fight or flight, we're aware of the stressor and we're getting prepared to take action. Now, what would normally happen, you'd see that the cycle starts with the stressor, and then the action is that we would do something to resolve that stress, and then we would recover. Okay? And the recovery is key. It's the key part of the stress cycle. Without the recovery, the cycle isn't completing, and that's when stress can compound and increase more and more.
As you're talking about that and you're talking about these sort of stressors in life, not all stressors are bad, are they? Sometimes we choose to subject ourselves to stress. I was just thinking, actually, as you were talking about being on a roller coaster, and there's that sort of build up, and then there's the ride, which is you're in your fight or flight, but you're having a great time. And then that recovery is when it goes at the end, and you start to recover and you get off and you feel really happy about almost the little buzz that you had.
Yeah.
So it reminds us, though, that stressors can be positive things as well, like preparing for a wedding or, having a baby. These things can create stress in the body, even though they're things that we want, desire, and are good for us.
Exactly. It's something that is part of our existence, and it doesn't have to be negative. But what I think is key to remember is the recovery and the resetting to bring our systems back to baseline so stress doesn't build upon stress.
That makes a lot of sense. Can we ever really come all the way back to baseline, or will we always react and respond to stress in the same way?
Yes, we can totally come back to baseline. Our nervous system is actually designed for that to happen. So you have the stressor, you'll have the action, and then you'll have the recovery phase. What happens is when we're under threat, when our nervous system feels under threat and we're in fight or flight mode and we're detecting threat in the air, what will happen is that we are not coming down from it. So our stress stays elevated. Okay. And so our baseline is elevated and it's shift because it's not fixed to a certain point in time. So to be able to shift the baseline to a place where we're able to be less reactive, to where we're able to cope more with the situation, we need to make sure we complete that stress cycle by incorporating pauses, incorporating recovery times. And that might look like breathing exercise. It might look like grounding techniques. These are things that are key to break up the moments between stressors, allowing the system to function as it's meant to.
And I think to share my own example, I think it might just be sitting on the sofa and watching a box set and being fully immersed in something else, probably not something stressful, something nice, but it helps you close all those tabs and just have a pause, have a break from everything that's been going on. Can we include watching box sets as part of our cycle?
Well, as long as we're mindfully doing that, so we're engaged in the present moment. So what we want to avoid is kind of traveling to the past or time traveling to the future. When you're in the present moment, you're grounded and you're regulating then. So that is a tool you can definitely use to help.
And we're hearing a lot about cortisol at the moment. So where does that fit into the picture? I think cortisol often gets a bit of a bad name. People call it the stress hormone, but without cortisol, we wouldn't be here. So where does that fit into the picture?
I think you're right. Cortisol isn't a bad thing. It helps us get up in the morning. It helps us to be alert. It helps us to problem solve. These are all positive things that can help us be successful. Where it becomes problematic is when cortisol levels stay elevated within the body. And that happens when there is a cumulative amount of stress with no breaks in between. And when the cortisol levels are elevated, we might notice changes in mood. We might become more irritable. We might feel less able to cope. We will also notice physical health symptoms. We might get headaches because of the levels that are constantly there in the body. We might get gut issues. This is something I hear about all of the time. So it's really, really key, as you're aware, is not to think about cortisol as a bad thing, but having too much And for too long, that's where the problems occur.
It's about regulation, isn't it? I think everything you're talking about is all things are good if they're happening appropriately, but this sort of baseline level of constant chronic stress or constant chronic elevated cortisol is really bad for us. At what point do you see stress starting to tip over into mental health conditions like depression and anxiety?
I think when it's not just in response to a specific situation. That's something that I commonly come across, where it's prolonged, where there's no easing in stress symptoms. And even when people are resting, even when the stressful situation has passed or they might have time off, that they're still feeling under stress. We know that without managing and coping with stress symptoms, that it depletes us in our energy levels. It impacts our sleep, it impacts our appetite, our exercise levels. And when we don't look after these basics, we can often find that challenges with other mental health difficulties do occur.
And you're talking about that fight or flight state. It makes sense, doesn't it? If you're constantly in that stage or you're further towards that state than you should be, that's when your body's prioritizing looking for danger. You're on high alert, you're switched on, you're tense, your heart rate is up, increases your blood pressure. And the things that are meant to happen when you're in your parasympathetic nervous system, the rest, that's when you rest and recover and digest and do all of those things and get deep sleep. So it makes sense.
Yeah, if you're not engaged in parasympathetic activity, then it's not gonna support calm within your body. It's not gonna support regulation. You're not gonna be able to complete that stress cycle, which means that it's going to be harder to cope with stress symptoms.
And we talk about how unaddressed stress starts to snowball and things get worse. Why does that happen? Why does it not just resolve itself?
Again, coming back to the nervous system, once we're in that high threat mode, we are focused on that stress. And when we're focused on that stress and we're in threat mode, we focus on the task and we don't allow ourselves to come out of it. So when we're already in a heightened state of arousal, adding additional stressors is going to create a snowball effect because we've never been able to break that pattern.
Claire, thank you so much. Next up, I'm going to introduce you to Michael Adu to talk about his personal experience and journey to managing stress. So stay with us, we'll be right back. Now I want to introduce Michael Adu to talk about his personal experience and journey to managing stress. And Michael, you now talk about stress for a living, but it did start with your own personal experience. Are you happy to share?
Yeah, sure. I had a very real and personal connection with stress from a very young age. I had something called stress-induced vomiting from a very young age, where stressful situations used to make me actually physically be sick. I remember there was a time when I was at school and it was coming close to prom time, and I was trying to prepare myself to ask the person I liked the most to come to the prom with me. And
stressful.
Yeah. And that situation floored me, where I was physically sick multiple times just from thinking of it. So it always got me thinking of, why can me and somebody go through exactly the same thing and my body respond in this way and somebody else's body respond in a totally different way? So then I started to look at how the body responds to stress and what is stress and all the things that we've spoken about today and how we can best manage stress. And that took me down a rabbit hole of looking at mental, physical, emotional, spiritual, nutritional things that we can do to manage stress. So now it's my kind of goal and role to teach people how to manage stress better.
And you're a personal trainer as well, aren't you? So you train people's bodies, but have you now incorporated all of that into how you support your clients?
Yeah, so my first introduction with looking with how we can manage our overall health and well-being was through physical being. And what you find is that normally we go to the gym with physical goals, but for mental reasons. So for example, I want to lose 5 pounds because I want to feel better about myself, or I want to feel more comfortable in my body. So there's a feeling there. There's always a feeling underneath a goal.
I want to get bigger arms, so I'm more confident to ask that girl to prom.
Exactly.
Did you ask her?
I did.
Oh, good.
Anyway, yes, she did.
Excellent.
So then, rather than just staying at that surface level, I always look to go deeper. Why? Understand what is the motivation behind certain things and understand what triggers are there in the body which are making this such a priority. And then we can manage that situation as well as or achieving physical goals as well. So it's all about combining the mind and the body and nutrition, everything in one, because everything interlinks with the other.
Yeah, absolutely. And breath work is a big part of what you do for yourself as well as helping others with. So how has that helped you sort of reclaim your health and well-being?
So my introduction to breathwork was quite some time ago, and I got into breathwork because I was looking for zero to low cost activities that you can do to manage stress. Typically, if someone said that they're stressed, what's the thing they say they want to do? They want to go on holiday, go somewhere and relax, which can cost money.
Yeah.
So I was looking for things that you can do in the here and now, in the moment, to help to regulate yourself. And breathwork was one of those things. So I looked at what breathing does to the system, how it affects our sympathetic, our parasympathetic nervous system, how it affects our body, and how it can act as a regulation tool when we are feeling stressed.
So have you got any that you can demonstrate to us pretty quickly? Or, I mean, first of all, before the demo, talk us through a few of these different breathwork strategies and ideally some that don't take all day.
Yeah.
Because we're all short on time.
Exactly, yeah. And I always start off with that time pressure activity, because let's say you're in the middle of a meeting, you need to go to the bathroom quickly to regulate or whatever it is. We look for tools that you can do to kind of auto-regulate in that moment. So one very simple one is box breathing. And what it is I'm sure many people know about it right now, but it's you're breathing into the count of 4, holding to the count of 4, exhaling to the count of 4, then holding once again to the count of 4. And that mechanism, number one, helps you to become present. So it takes your mind out of thinking about the past or the future and gets you into the here and now.
It's interesting that that's the first one you would mention, because that's one that I often use between patients. You know, as a GP, it's one after the other. And sometimes a consultation can leave me in a state that I know is not the best state for me to see the next patient. So within less than a minute, I can do a few rounds of box breathing and it completely resets my nervous system.
Exactly. So yeah, I call it a regulation button where you just click it 1 to 2 minutes, and then you're feeling a lot more centered and a lot more grounded, a lot more able to respond rather than to react to situations.
I wonder if viewers are watching and thinking, I need to know more. Would you demonstrate for us? Shall we all do it just for 30 seconds?
Perfect, yeah. So what I like to do is both feet placed on the floor, palms on your knees, and just gently close your eyes. Just relaxing your shoulders, relaxing your back, allowing your body to relax into the cushion, into your chair or whatever you're sitting on. Closing your eyes and just start off by observing how it feels to breathe in through your nose and out through your nose also. And just become aware of the temperature of the breath as it comes in and how your body moves and adapts as you breathe, whether it's your chest, your stomach, your lungs, how they're moving as you breathe. The pressure of your clothes, how they change as you breathe in and out. And also become aware of how it feels for your bum to be on your seat, your palms to be on your legs. The feeling the fabric of your clothes, of your skin. Feeling your soles of your feet on the floor. Breathing in and out. And we always start by doing this just to bring a sense of grounding and present moment awareness into every practice that we do. And then we're going to start our breathing practice where we're going to breathe in to the count of 4, hold to the count of 4, breathe out to the count of 4, and hold once again to the count of 4. So taking a couple of introductory breaths before we start. So breathing in and release. And again, in and release. One more time. In and let go. Now breathing in for 4. Breathing in, 2, 3, 4. Hold. 2, 3, 4. Release. 2, 3, 4. Hold. 2, 3, 4. Good. And return back to your normal breathing. Just become aware of how your body feels. Scanning from your head, your shoulders, your neck, your chest, your back, your hips, your thighs, calves, your heels and feet. And as I count down from 5, slowly open your eyes and enter back into the room in 5, 4, 3, 2, and 1. Open your eyes and back.
Lovely. Thank you. I needed that today.
I'm sure our viewers, just like us, you feel different.
Yeah.
And for the sake of once we actually go into the box breathing, and it can make such a difference, cost nothing.
100%.
You can do it anywhere, but not with the eyes closed if you're driving, obviously.
Safety first. I call like the volume just turns down a little bit.
Yeah.
Where you can sense that sense of stillness, that sense of calm, where you can be a lot more intentional rather than reactionary, where you can be a lot more present rather than just thinking of past, future.
Yeah.
It just brings you into the here and now and it enables you to be more conscious of what you're doing, how you're feeling, what you're experiencing, and how you can counteract. And we're speaking about sympathetic and parasympathetic. And when we're in a state of stress, we're always thinking go, 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 go.
Yeah.
It just gives you that pause.
It's the reset that's so important and is essential to be able to cope with the demands of life. So that's a lovely way. And as you said, it's cheap, it's quick to incorporate and to repeat as often as we can.
100%.
It's that reset recovery
Yeah,
that
exactly.
we need to complete the stress cycle.
Yeah.
So I think, thank you, Michael, that's a really good example of something that we can actually do, that we can take away. Coming back to you, Claire, what other small realistic steps can people take to reduce stress? Even when, the external circumstances haven't changed, the world is still stressful. What can they do?
I think Michael just gave a really lovely insight into something small that you can do. But it's really also additionally focusing on rest, on sleep, looking after your diet, making sure that you're getting exercise, whether that be through gentle walks or through something more vigorous. Making sure that you're not overstimulated. We're bombarded every moment of the day through our screens, on every, so many different things, to kind of reduce that stimulation, to allow ourselves to, climatize to a slower way of being is really important. But fundamentally, seek help. That's what's really important. If it becomes overwhelming, if it becomes unmanageable, seek help. There's lots of ways that people can get support for these symptoms so that they can cope and manage.
So what else can be helpful?
It also helps to have support that's easy to access. So through Bluer Wellbeing on the My Bupa app, members can use expert-led mental health resources, mindfulness tools and guidance whenever they need. And we're making it even easier. Customers with mental health cover now have access to a treatment option called Members First. It means that if you have talking therapies provided by a Bupa service, there's no excess to pay, no impact on your outpatient allowance, no claims discount, or on your low claims bonus. It's also our way of making sure that costs don't hold you back when you need support.
And talking about the things you mentioned there, so the sleep, the nutrition, just giving yourself a bit of a break. From a psychological perspective, why is it those types of coping strategies that work?
I think because as we have just felt the lovely relaxation that Michael has just provided us with, what's actually happened there is that the threat system's deactivated and the parasympathetic nervous system that supports calm and recovery, that's come online. And that's why they interrupt stress patterns. And if we can repeat these behaviours frequently, that can really have a positive influence on how we respond to stress going forward.
And Michael, any further tips you'd like to add or any advice around how people can detect stress within themselves?
One key thing I like to tell people, I use it within my sessions, my coaching sessions, is spending time in nature. For a multitude of different reasons. Firstly, because when we have a landscape of green, it automatically triggers within our central nervous system that we are in a space of safety. I think one of the key tools I would say is to enter into nature as much as possible. I often take people out on walks to speaking sessions so that people can automatically start to downregulate just by being in nature. Just a landscape of green helps our central nervous system to calm down and to relax. And also being active while sharing can help to free up any pent up emotions, frustrations, and so on and so forth. I really find the value of being in nature and also moving whilst kind of unwinding and letting go to be a great aid to people that maybe don't feel comfortable with sharing initially. Some people struggle to sit down and display their problems. Some people have to be doing something or mindfully doing something in order to feel that level of comfort to share and to let go of whatever they're feeling.
Michael, how easy or difficult was it for you to reach out and get the help you needed when you realised, as you've explained to us, that stress was having such a physical but alongside that, such an emotional impact on your life?
If I'm honest, I don't really think at the time when I was going through this, and this was going from 12 years old to my late 20s, early 30s, I never really sought help. I think there is a very big piece around masculinity and manhood and mental health and how it's seen as a form of weakness or seen as a hindrance for us to seek help. And I was definitely part of those section of individuals. And that's why I've tried to have a level of understanding with people and of people's mindset and how they think and experience the world. So I think it is very tough for some individuals to come out and be quote unquote vulnerable. But I think it's one of the key things which enables us to let go and release and enter into that state of recovery, enter into that state of rest and digest. Because if we're always holding things in and always being pent up, we're constantly staying in that very low or mid-level of arousal or stress or activation. So just being able to be comfortable, to find a space, to let go, to release what I'm experiencing enabled me to kind of accelerate my recovery a lot better.
And Claire, why is it so important that we learn to recognise the signs of stress and take a pause so that we can stop it from escalating?
Just like Michael said, our system needs to rest and digest. And when we're busy, we are so task focused. When we're under stress, we're focusing on the challenges we're going through. So we're not noticing what's going on in our body. There is no mindful awareness of the psychological or physical symptoms that we're experiencing, whether that might be irritability or feeling overwhelmed or headaches or gut problems. All of these things that we're just ignoring, they're going to come back and bite us, really, if we don't get the attention that we need. Our body does signal to us that I need help. And it's for us to really use those pauses, those resets, to be able to take time to listen and respond to what it needs.
I have an analogy that I use with some people. Imagine there's a stone in your shoe. You're going to initially start off by feeling the pain of the stone hitting your foot. But after a while, if you ignore the pain, the cells around the stone will die and you will no longer feel that pain. And what we've done as a society is we no longer feel the symptoms of stress. We just constantly work through or push through or strive through. But the stone is still there and it's still causing us a sense of discomfort and pain. But we've just masked the physiological response, and eventually it could manifest into other things in life.
Could cause a severe infection, for example, and then the whole system breaks down.
Exactly.
And that's what happens. It's a really good analogy. Michael, if there are viewers watching this right now and what we've just been talking about resonates with them, they think, this is me, I have all these symptoms, I think I'm stressed, what would you want to tell them?
I think first things first, there is no one size fits all when it comes to stress reduction or stress relief. It's about what works for you. So me and you and yourself could be all doing the same thing, i.e. meditation or breath work, and it would have very different effects on all of us. So the goal is to find our own personal toolkit of stress reduction activities. I think it's about understanding who you are, what works for you, and how we can best create those pauses within our stress cycle so that we can become more resilient and effectively manage our health a lot better.
So what else can be helpful?
So using the My Bupa app, it's really easy to download and register if you haven't done already. You can book a digital appointment with a GP or a mental health practitioner at a time that suits you. If you're worried about someone in your family, you can also call our family mental health line to speak to a trained advisor or a mental health nurse.
Well, we've talked a lot about what stress really is, how it can slowly build, and what it can feel like when it starts to take over. One of the things I'm really aware of is that stress does look different for different people. And so the questions that people have are often the same ones you might be asking yourself at home. So it is time to go to your questions. Many thanks to all of those who've been getting in touch, and we will answer as many as we can. So our first question comes from Martin, and he's written in saying, this one's I think for you, Claire, I feel stressed pretty much all of the time, but I don't know if that's just normal life now. How do I know when stress isn't normal anymore? How do I know if it's bad enough to get help?
It's an excellent question, which I hear so often from my clients. And the answer in short to that is if it feels prolonged, that it doesn't ease off, if it's not situation specific, then it seems to be tipping into something else. If it's having an impact on your sleep, on your appetite, on your mood, if there are physical symptoms that are accompanying it, we've talked about the mind-body connection, and that is a valid response to stress. And if there's changes that he's noticed, think about getting support to build your toolkit or toolbox, so you've got a smorgasbord of different coping strategies that you can learn and you can dip into that are individual and work for you.
And I think what's really smart is you don't have to wait until it's really, really bad. The sooner you act and build this toolkit, the better. And, the easier it is to start to manage. The next questions come from Layla Michael. She's asking, did you ever tell yourself just to get on with it rather than admitting how stressed you actually were?
100%. I think all of us I think it's part of the human experience. Sometimes we do have to get on with it and just push through. I call it championship rounds. In life, sometimes we have championship rounds where we just need to go. Like being a parent, like this championship round, you just have to go. Sometimes in your career, you just got to go. But it's about understanding and noticing those times, and then allowing times to rest and recover after those times. So completing that stress cycle. Because if you don't, that's when it becomes a problem.
Yeah, I like that. So like hot yoga on a Friday, you don't have to take that one, do you? You could skip that one if actually what you need is just to go in the spa.
Yes.
Yeah.
Exactly.
All right. Noted. We've had quite a few questions about physical symptoms, and I think, your own presentation of stress with the vomiting is really interesting. So this question comes from James. I get a lot of physical symptoms, headaches, stomach issues, feeling exhausted. Can stress really cause things like that? I think from Michael, we've seen that absolutely they can. And do you see a lot of that, Claire, in clinic as well?
Yeah, I see a lot of people presenting with gut issues or headaches or repeated illnesses. And it takes a long time for them to make the association between stress and the physical response, because to them it doesn't make sense. Well, this is in my head. It's not. It's valid. What you're experiencing physically is very valid. And if you're taking steps to manage it and there's not a positive impact on that, you need to listen to your body again. It's telling you that you need that extra support.
Musculoskeletal issues as well. I see so much of neck pain, back pain, shoulder pain.
Yes.
And actually the stress, it's all interlinked, isn't it?
Yeah.
This is a question that's come in, sort of building on that really. Michael, you mentioned that you had a physical response to stress, but did it also affect your mood over time?
Yes, it did. It affected my mood because I felt like I had a lack of control over my system. And I feel like that's when it can really affect somebody, because as we said, we like to push through with life. And even if we do feel something, we just keep going. But then when it affects us, how we represent to ourselves, our family, our work, someone that we love and care for around us, that's when we can really take a step back and be like, whoa, this thing that I thought I was in control of has now taken a sense of control over me. So I think we don't want to wait till the last moment before we seek help. The goal is to understand that we're all experiencing stress and we all need that sense of relief, or we all need a personal toolkit. But if we does get to that stage, seek help as much as possible.
Keeps coming back to that last bit of the cycle, which is really clear in my mind now, about the recovery. And if you're not managing that, you're not coping with life, and you can't manage that, then getting help is a good idea.
Yeah.
Next one's from Raj. I sometimes feel like I shouldn't complain because other people have it worse. Does that way of thinking make stress worse? Claire?
I'm smiling because this is something I hear
All
really much all of my clients say. And physically, everyone's nervous system is different. As you said, Michael, what's going to work for one doesn't work for the other. And that also means that our nervous systems respond differently. So there's no point in comparing yourself to other people who, we often look at people, oh, they've got it much worse, I shouldn't be feeling like this. Well, you are feeling like this, and do you know what? You're making it worse now because you're adding feelings of guilt and shame on top of it, which can compound the stress response even further. So it's about incorporating a bit of self-compassion to recognise, A, I don't need to be at rock bottom to get support. B, that there is support out there and it's accessible. Comparing to other people isn't helpful when we're going through challenges in our life. It's not generally helpful in anything that we do. It can really create a negative feedback loop.
And as well, if you think about it, our nervous systems are still very primitive. Our nervous system doesn't realise about how our worlds have changed and how technology has changed. So we might be witnessing somebody suffering who lives on the other side of the world. Our nervous system doesn't understand the internet and social media. It's to your nervous system, that suffering is very real. So I think we're exposed to so much more now than is natural for the human experience, and our nervous system doesn't get it. So we're all over the place. No wonder.
Yeah, exactly.
Good job we're having this conversation. Thank you, Claire. The next question is from Yasmin. What if you're stressed about your situation, but you can't change your situation? So, for example, it's your job or it's caring responsibilities. What can you do then, to Claire?
I feel that we've all experienced this in life to a certain extent, and often we can't change the stressors, sadly. But what we can do is change our bodily response to the stressors. So that is what we've been talking about today, really, incorporating the rest and recovery, prioritising that as part of the stress response cycle. That needs to make sure that our nervous system in threat mode is deactivated, our parasympathetic nervous system comes online. These are all things that you can do despite the situation. And of course, as we've been saying, we've been really clear on seek help. If you've got a trusted friend you can speak to offload that with, great. When we're feeling in pain, whether that's emotional or physical, we tend to isolate. But sharing with other people can be really helpful. And also, there's also professional support out there if you need to learn new strategies to how to prevent the stress or how to prevent symptoms escalating.
I think that's really important. You know, we can't always change our external world, but to some degree, we can change the impact it has on us by using these tools that we've been discussing. One for Michael, this is from Tom. When you couldn't change what was causing your stress straight away, so when you were in the thick of it, what helped you cope day to day?
I think is the micro recovery periods that I could create. And I was very intentional about creating these micro periods. I feel like I'd always saw it as a wave. And with the wave, the goal is to make the wave come down, even if it's momentarily, and then you can enter back into whatever the situation is. Because I depict it a little bit like exercise. When you're working and you're moving and you're stressing muscles, so you're stressing your body, if you don't effectively rest, then your body doesn't get stronger.
Yeah.
And I like to think of using stress as a form of strengthening activity if done in the correct way. So I think I reframed it in my mind in terms of this is building me to become stronger, more resilient. But the key priority here for me is to work on my recovery and my rest, and to be as intentional with my rest as anything else. So
Yeah, it's really interesting. So repeated bouts of stress with recovery make you better adapted to deal with stress.
100%.
But if you don't have that recovery, you lose the resilience and you get that snowball effect that we've spoken about. I think that's a brilliant example of that. Next question is from Emma for Claire. A lot of people turn to supplements when they're feeling stressed. How do you know when that's helpful and when it might be time to seek professional support instead?
I think supplements, they do have a place, and I think they're a fantastic adjunct to other coping strategies and coping techniques that people can employ. What supplements don't do is that they don't target the psychological drivers of distress. So if we're on supplements, we need to be monitoring ourselves. Have my stress symptoms changed? Have they got better? Have they got worse? This monitoring is key, because if they are getting worse, you need some additional support. So essentially what I'm saying is supplements are great to sit alongside professional support, but I wouldn't necessarily recommend them as the only intervention that people take.
That's why I often say as well, especially if the supplement's expensive, try it, but keep a diary and see if it works. Because, if it's expensive, but it's really working, maybe you want to continue. But if after 3 months you've noticed no difference, you're better spending your money on something else.
Yeah, it's that monitoring. Yeah.
Okay. One last question, because we are running out of time. This one's from James to Michael. I'm worried about opening up at work about how stressed I am. I think it might affect my career to be seen as a stress head. Can you give any tips on starting a conversation with my manager?
I think the world we're living in now, I think stress is a lot more of an acceptable subject to talk about. If I think about my father's era when he was in the workplace, you couldn't mention the word stress because could affect your career. But now I feel like there's a greater level of awareness and attention on mental health, on stress, and especially the capacity that we have as human beings and what we're experiencing. So I would always encourage to have a private conversation with your line manager, whoever you report to, and express how you're feeling, express the concerns you're having with your ability to manage and cope with the stresses that you're experiencing, and seek help and support from work, first of all, and also seek help and support from people around you. I feel like we're living in a world now where this is a lot more socially acceptable for us to speak freely and openly about what we're experiencing. So I would definitely encourage you to have a conversation with the people that be.
And look what it's meant for you. Sort of opening up about your own experience means you now help so many other people, and you've benefited personally. So it's a great example of that. Thank you so much for sharing your questions. Honestly, so many of these reflect what people quietly carry, but often without talking about it. We're almost out of time, but I really hope today's conversation has helped shine a light on stress, how easily it can creep in, how real its effects can be on both our minds and bodies, and most importantly, how it doesn't have to be something you just push through on your own. If there's one thing to take away, it's that noticing stress sooner and taking small steps to address it can make a real difference. Stress isn't a personal failure, it's a human response, and support is there when you need it. A huge thank you to you, Claire, for your expertise, and to Michael for sharing your experience and all of your advice. And if anything that we've discussed today has resonated with you, please remember, if stress is starting to affect how you feel, how you cope, or how you live day to day, that's reason enough to reach out for help. Whether that's talking to someone you trust or accessing professional support, you don't have to wait until things feel unmanageable. So thank you so much for watching, and please take care of yourselves.